Hello, my name is Malaysia and I am going to be discussing the future of the pharmaceutical industry as sold by Nadin Zejnilovic. Now, using the Shells methodology, I have interviewed a very good friend of mine who has extensive research and development experience within the pharmaceutical industry. She's worked through a variety of projects, including the back end of an outsourcing drug facility, as well as drug development itself. So I figured she was a very good person to interview for this subject matter. Now, when discussing the critical issues regarding drug development specifically, Nadine has mentioned the lack of an innovative outlook and a lack of innovation in the field in itself. And her perspective is that people are usually discouraged by the heavy regulations that are placed upon them as far as the FDA, which we have in the US, the Food and Drug regulations that we have to abide by, which will affect the amount of time that it takes for the product to get to the market, the amount of research, the processes that are going to be set in place as far as the drug development process goes. Now, while I agree with this, I also feel that it is important to stress the line that we draw between digitizing things and making sure that this fits into our society as a whole and the functions that we have and the political grounds that we're standing on. So if we decide to digitize certain processes, if we decide to change certain things, where are we going to draw the line as far as making sure these things are still safe, making sure that we are ultimately providing the greater good with these products, which is the reason why we're having them. And I feel that that can be lost as far as trying to decrease the amount of time, trying to increase efficiency. While I do agree that with Ms. Nadin Zejnilovic, when she mentions that some of the processes can be digitized as far as research goes, which would decrease the manufacturing costs, that would decrease the cost of general funding that we would need to do research, I still feel that there is a certain aspect when it comes to healthcare, specifically when it comes to the drug industry and development for that. We really should be careful when it comes to digitizing certain processes because it can ultimately do more harm than good in certain circumstances. Also, when we are discussing this, we also should keep in mind that the generation in itself is moving towards a more sustainable, a more organic and natural approach when it comes to all products, even diets, hair care, skincare, and beauty and cosmetics. So of course, when it comes to drugs and medications, we are also taking on a very holistic approach when it comes to this. And this was outlined by Nadine that we should start focusing on what the trends are going to be and how we can service them now. And finding a way to catch up to the market before we lose it. And I can agree that a lot of people have been using oils and plants and their own remedies to solve a lot of the issues that we've been seeing, and we've been seeing a decrease in the amount of prescription drugs that people are purchasing. The changes we would make, I suppose, would be increasing the level of health education, especially for the youth, and just making sure that people understand the needs for these drugs, and ultimately not being afraid of technology and using it when it's necessary, but also making sure that we are aligning the needs as well as the uses for these products. And not being, again, afraid of technology, but using it to our benefit instead of trying to completely overturn the whole industry with technology. We also have to keep in mind that society is creating their own trends, and if we want to be servicing our clients, we have to follow the demand, which is leading to a different approach, but the most we can do is keep up with technology and keep up with the demand of our clients. Thank you.